Just one day after the House passed a plan to repeal and replace Obamacare, we're hearing from local officials about its impact on the Ocean State.
And we caught up with Governor Gina Raimondo today to get her thoughts on the proposal, which now heads to the Senate for approval. Eyewitness News reporter Jared Kleiner spoke to the governor today. He joins us now live from the East Bay Mobile Newsroom. Jared?
Mike and Shannon, well, all five of Rhode Island's leading Democrats were here at an event in Bristol today, and that is where we saw them. And not surprisingly, all are in strong opposition to this measure as it now stands. The Republican replacement of Obamacare now through the U.S. House of Representatives. Republicans there celebrating Thursday's vote, saying the bill returns control to the states and provides relief from an unsustainable Obamacare. Governor Gina Raimondo was on Eyewitness News this morning. She says Rhode Island is a state that's benefited from Obamacare, a law that should be repaired, not thrown out.
There's 100,000 people that have health care coverage that's basically affordable, and I talk to these people. Gov, I get to go to the doctor now. My kids get to go to the doctor now. I have cancer.
The Raimondo administration says the Republican plan, if it holds, could mean a loss of almost $200 million in federal Medicaid dollars over 4 years and drive up the number of uninsured people. As for what's in the bill, young people can remain on their parents' plans until 26. Flat tax credits based on an age scale to buy insurance with. Not in Obamacare's individual mandate, buy coverage or pay a fine. That's gone. Perhaps the biggest question concerns pre-existing conditions. Obamacare bars insurers from denying coverage based on existing illness and from charging sick people higher premiums.
Although they say it covers pre-existing conditions, it really does not, because states have the ability to waive that as one of the requirements.
It's a terrible piece of legislation. It's bad for Rhode Island, and I plan to keep up the fight because I don't want it to get through the Senate.
Now, House Republican leadership says there are no changes to Medicaid until the year 2020, and that would affect new enrollments only at that point in time. As for pre-existing conditions, the bill has $8 billion in it to cover that very area, but there are many experts who believe that $8 billion is not nearly enough. Coming up new at 6 o'clock, is this all dead on arrival in the United States Senate? We take a look at that. For now, live with the Mobile Newsroom, Jared Kleiner, Eyewitness News.
Tonight, the health care bill passed by the House is facing a lot of skepticism in the Senate from both parties. Eyewitness News reporter Jared Kleiner spoke to members of our local congressional delegation today, and tonight is trying to cut through the partisan rhetoric to tell you what you need to know. He joins us live from the Mobile Newsroom with the follow-up.
Well, Shannon, it is no surprise that all five of Rhode Island's leading Democrats are opposed to this, and tonight, Republican leadership in the Senate says they will be drafting their own bill. The Republican replacement of Obamacare now through the U.S. House of Representatives, but is it dead on arrival in the Senate?
I think so. It's getting a very hostile reception from the Senate Republicans, and that's not a good sign.
House Republicans say the bill returns control to the states and provides relief from a spiraling Obamacare. But why pass a bill knowing Senate Republicans aren't on board?
President Trump campaigned on it, and they were, I think, embarrassed that their first effort had failed, and so they were just prepared to go forward. It's like one of my Republican colleagues said, it's like a kidney stone. You just want to pass it.
As for what's in the bill, young people can remain on their parents' plans until 26. Flat tax credits based on an age scale to buy insurance with. But perhaps the biggest question concerns people with pre-existing conditions whom Obamacare mandates coverage for. Does this bill do it? House Republicans say yes.
No, it's not even close to true.
$8 billion put into the bill to fill coverage gaps in states that opt out.
$8 billion is not a big number for an entire country of high-risk patients.
And the Raimondo administration says that Rhode Island could stand to lose almost $200 million in federal Medicaid funding over the next 4 years up in Massachusetts. Republican Governor Charlie Baker has said the Commonwealth stands to lose $1 billion or more in the year 2020. Live with the Mobile Newsroom tonight, Jared Kleiner, Eyewitness News.